Scale is not scientific. What you said about this, here and there it's fine. But this is the definition of psychotherapy which was given by Oldberg in 1977. Psychotherapy is the treatment by psychological means of problems of an emotional nature in which a trained person deliberately establishes a professional relationship with the patient with the object of one, removing, modifying, or retarding. That part comes there. Existing systems and mediating disturbed patterns of behavior. You talked about behavior, but you have to do that in a systematic way. And promoting positive personality growth and development. And later, you find this is one of the classical books in psychotherapy. Even now, people do follow this for understanding various concepts which Dr. Krishnadat was referring to yesterday regarding this transference, counter-transference. What are the signs of what are the types of what are the signs of different types of transference and all those things we'll get in this. But we have a new definition which is approved by the American Psychological Association and by the European Federation for Psychological Associations. So here, psychotherapy is defined as psychotherapy is the informed and intentional application of clinical methods and interpersonal stances derived from established psychological principles for the purpose of assisting people. So it's not, you find a change from the treating people to assisting people to modify their behaviors, yeah, you're right, and the cognitions, emotions, and other personal characteristics in the directions that the participants be desirable. So you might, I've just highlighted some of these words because they all need more of a discussion. I'll not go into that because then I'll not be able to proceed on my topic of integrated psychotherapy. The participants being desirable is something which is very important. How many of you have been into therapy? Can you read how many of you are actually helping clients? So I'm not talking about the free psychotherapy we give to the roommates and the friends and all those things. But that may be called as the social support that we provide. We all do that. Fortunately, in India, we have that kind of social support which is freely available within the family or cousins or friends, etc. That's also good. But when we talk about psychotherapy, it's a very professional thing. Yeah. And how many of you, anybody who has treated a client or seen a client in a formal or informal manner? No? Yeah.
So we have seen the clients actually go for the internship mastership. So we have seen them.
Okay, so what was your experience? Yeah.
So it was insightful like listening to the clients in the actual setting. Over there, we are allowed to take clients in the separate room and we interact with them. We take a listening power. So it's insightful session because they have a raw data over there, not from the book or this.
You don't have to tell the details of the person, as I mentioned, it's confidential. Without telling any of the details of the person, can you tell for what problem that they have come? Is it possible? Okay.
So we mostly see people of depression and anxiety. Uh, so, um, so one patient I can say, can I mention the age? No, not the age. So he's a teenager, 14 years old, and he was suffering from acute transient psychotic disorder. And so the problem was that that suddenly he was normal, he was good in studies, from low social economic background, but he was good in studies. Suddenly he came home one day and he started vomiting, and he was not able to reply to anybody. He was sitting, like we can say catatonic schizophrenia, and he used to stare, he no used to answer anything. So this was the problem. He was not sleeping, loss of appetite. This was the case in Alex.
Your internship was really good. You learned a lot of things. Good to know that. Yeah. So a lot of things when you said about 14, I was happy to hear more. A lot of adolescents these days have brought with complaints of what? What are the complaints that? What are- When you were an adolescent, what was the complaint your parents used to say about you? Not all of them.
Adolescents were not independence, they were lot of freedom. I am coming to adolescent right now.
So freedom,
Freedom.
to be independent and to be alone and to be with friends, more with friends and peer groups.
That's what you want, right? You wanted at that time those things, but what were your parents complaining about you? Okay. So you may be brought saying that no, this girl is not doing anything at home. She's always with the mobile, lying down, not even helping me in the kitchen, washing the dishes, blah 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 blah. So when we talk about changing or helping people, you need to see whether that is something which the participant wants or not, whether that person wants to do work or not. So this is a tricky thing. You're reminded of something. Okay. So this is kind of a tricky thing. For simple things like doing tasks at home is different from the person who is in a relationship and the parents want the person to be out of it. Or the person is in the mobile or different kinds of lifestyles. So specifically, this is more relevant when people talk in terms of gender orientation and things like that. So that we have to really be cautious in defining not really defining the terms, but understanding it fully so that you can practice it without any difficulty. There is Strasbourg Declaration on Psychotherapy from 1990 is there. I'll just go to the last slide in that screen to make you sure that full psychotherapeutic training covers theory, self-experience, and practice under supervision. So this is one thing which is very difficult in our Indian context. Many people want to learn that, but when you ask about supervision, that's something which they don't like. I don't know why. This is again something which can be taken as a research problem. What is your attitude towards supervision? No. Whether the supervision reminds you of your mother, who is telling you to do this, do this, do that, the supervisor is also making you do that, or what are the different dynamics of it is something which has to be looked upon. But self-experience, if you have, is very good if for an effective psychotherapist. And we need to be understanding the context also, which I mentioned yesterday. The context and what's your name? I forgot. Sakshi. Oh, that's easy to know. Okay. Sakshi was talking about low socioeconomic class. Yeah. And you'll find the caste, race, and religion-wise, culturally, ethnically, and linguistically diverse population. Economically, also, you can add to this because that's the context that we have. This photograph is from the tsunami days where we went to the seashore to help people. Yeah. Yeah. Any question at this level before I go into integration? Any question? Workshop means we have to work together. Yeah, anything?
Anyone?
Please. Any online questions? Is there anything on the chat is there anything in the chat?
No, sir. No question.
No questions.
No question.
Okay. Hope they're linked, yeah.
Yeah, they're
Yeah, we know that during the COVID times we'll switch it on and we may not be present there. We are connected. Yeah, everyone is smiling, so I think that's a shared experience of all the participants. Yeah, please ask some questions. No questions? Final years. Yeah, madam, you are first final year, right?
Master's first year.
First, within a couple of months, you'll be in second year?
First year, second semester.
Second semester, yeah. Okay. It's getting over, yeah?
Almost.
Almost. Yeah, any question, please?
Yes.
Yeah. See, when I talk about integrative therapy, I'm actually at a dilemma. Because you can integrate, for you to understand integration, you need to know different types of therapies. So if you are not aware of the different ingredients available in the kitchen, you may not be able to make a new dish like a sambar in the south, or I don't know what the equivalent for that in the north. Something you are aware of sambar? Yeah, oh yeah. Pardon? Weird, yeah. Yeah, okay. So for that you have to have different kinds of ingredients. So if you are aware of the ingredients, then you can make a new dish. Otherwise, it will be difficult. So tell me some of the therapies that you know of. You can, don't worry.
Therapies के नाम बताओ ना, just tell them.
Yeah. Yes.
Sir, we have the most common psychotherapy, and apart from that, we have aversion therapy, we have exposure therapy, and we can have client-based therapies, RDBT, DBT, music therapy, art therapy. Rational emotive behavioral therapy. It basically comes from how we rationalize our thoughts, like our thinking processes, how we react towards it. Basically,
Positive psychology. From positive psychology, we
sir, how irrational thoughts are converted into how we rationalize them.
No, I'm not going to RDT. I was just trying to understand about the theories behind it, or the different kinds of techniques that are available. Because when we talk about, since I have to talk about it, I'll run through that. I'm not sure whether how beneficial it would be for you. How many number of therapies are there? You said about 4 or 5? Yeah. Aversion, behavior therapy, play therapy, REBT, CBT, DBT. Yesterday, what Dr. Ashutosh was talking about, you said it. Anything more than that? So, what would be the number? Just give me a blind number. Wild guess. Pardon? 50 to? What's your name? Does it include anesthesia therapy also, or no? Okay. Yeah. 14. Above that, yeah. Above that. Anesthesia said 40. Without 41, if you include anesthesia therapy also. Yeah.
The 99.
Pardon?
The 99.
No, above that. Yeah. There has been this number 450 to 550, some people even quote it as 550. Sorry, some people even say it is now 1000, because this is a count which were reported in the late 90s. Because if you include the mindfulness based approaches, different things have come. Yesterday I was listening to someone who was talking about smiling yoga. So that's a new therapy just now. So if you add on that, those kind of things like that, and include anesthesia therapy, that will be going to long way up. Yeah. So when there are so many therapies are available, the problem for the new therapists like you who are entering into therapy would be, which one should I study first? Which one is going to be of use to the client that I have? The boy who has come with stuporous state, which will a kind of a therapy, like supportive therapy would help him along with the pharmacological treatment, or is there some other modality that you can think of? So, the research studies have shown that I'm talking about not in those kind of situations which Sakshi mentioned, in the other situations when people have different kinds of problems like pardon? Anxiety, yeah. Okay, good. Anxiety or okay, that's slightly complicated. We may not be able to help all of them with pure psychotherapy alone. Yeah. Anxiety is a common thing. Yeah, I would say that there's a lot of things like problems of living, which we all have to be prepared to help. You may not be able to diagnose them, as Sakshi was telling, do MSc and diagnose them, categorize them. There are a lot of people with problems of living, adjusting with the parents, adjusting with the spouse, adjusting with the siblings, or trouble walking through the roads. Those are all problems that we have in India. I was talking about the cultural specific issues, which you may not find in the textbook. So we have a lot of problems of living added to the cultural or the socio-cultural issues that are coming up in our society as we move on. So if you take the research studies, they have shown that people with different kinds of problems, but when given different kinds of therapies, almost all of them have same kind of a response. So whether it is CBT or DBT or different kinds of psychoanalysis or different kinds of things, they all seem to be having certain common things which are helping people. So it might mean that you may have to be happy with the therapy that you are comfortable with and use that so that you can help more and more people. And they found that there are 89 commonalities proposed based on a review of 50 publications, which say that the most consensual were clients' positive expectations. So what helps in the therapy is I go to a hypnotherapist with the expectation that he or she is going to help me. So that expectation is what can make a difference. The second thing is the facilitative therapeutic relationship. Are you aware of this facilitative therapeutic relationship? No. First year? Yes? No? Yeah? Final year? Final year of what? Pardon? Yeah, bachelor's or which subject? Psychology. Okay, yeah. So, which college? Huh? Integral University. Oh, yeah, please. Yeah. Don't, please.
So improving the
I just said
relationship,
it, yeah.
improving the relationship between the client and the
Yeah.
therapist.
Yeah.
How to facilitate that?
Can you show that? How do you facilitate the relationship? Yeah.
Just full flip.
Yeah, come.
You were asking.
Come. Yeah. You get a volunteer. Let's see how it goes.
Come here.
You,
Yes.
come. Please. You please come. We'll get one volunteer. I'm sure Lucknow people are very active and they come. Yeah, one volunteer more, please. Sakshi, come. On the Anusha, 80. Yeah, would you like to come? No. Because we have all, so who is going to be the helper and the helpee or the therapist and the client or? Client. Okay.
Shakir. Shakir bhai. Shakir bhai.
So,
Drive है क्या?
what is your name? My name is Sakshi.
अच्छा रेंज ले.
Where do you live? I live in Lucknow. What is happening to you? What are you going through? I don't feel like, I'm not myself and I don't feel like studying at all. I'm being pressurized, like, okay, I understand. So, how are you feeling right now? Okay, I suppose.
With classmates. Oh. Okay. Yeah, so would you like to give any feedback on what happens now? It's only to the helper and the helpee, not to. And Fisher, not to Fisher and such. How will it go?
Sir,
Yeah.
it was pretty straightforward. What is your name? Pretty straightforward. You have to build a rapport. Therefore, it means good morning.
Come. Yeah. Are you okay? Start. Yeah.
Good afternoon. How are you?
I'm good. Good afternoon.
My name is Shreya Tiwari. I am your counselor today.
Okay.
May I know your name, please?
My name is Sakshi.
So, how are you feeling today?
I'm feeling okay right now.
From the path here, do you feel how was your path to that chair? यहाँ तक आने में आपको कैसा महसूस हुआ? कुछ ऐसी तकलीफ या लगा हो कि हाँ मन नहीं करना चाहता? कैसा आपने फील किया?
नहीं, मन तो था मेरा, मतलब पढ़ाई में मन नहीं लग रहा है, टीचर्स से कोई सपोर्ट नहीं है, पेरेंट्स प्रेशराइज कर रहे हैं, तो फिर हम आपके पास आ गए।
जिसका मतलब आपको वॉलंटियर एक्सपीरियंस आप आना चाहती थी कि आप किसी में टीचर थे?
नहीं, मैं खुद से आना चाहती थी, अब कहीं से मदद नहीं मिल रही तो आपके पास आ गई।
एक्चुअली आपको ये पता है कि आपको इनसे मदद नहीं मिल रही और आपको ये इंसाइट था कि आपको एक काउंसलर से या एक प्रोफेशनल हेल्प मिल सकती है। दैट्स अ ग्रेट थिंग। इट्स अ साइन ऑफ पावर दैट यू हैव।
जी, जैसे कि कैरियर काउंसलर होते हैं ना, तो मुझे लगा कि पढ़ाई में आपसे कुछ मदद मिल सकती है।
और अपने एक्सपेक्टेशंस जो आप चाहते हो कि आप इस काउंसलिंग सेशन से या इस जो सेशन हमारे बीच होगा या आप चाहते हो कि फ्यूचर में आपको चेंजेस आप में दिखें?
मैं बस ये चाहती हूँ कि मेरी पढ़ाई अच्छी हो जाए, मुझे ना रटना ना पड़े।
प्लानिंग इज वेरी इशू।
हाँ, और मुझे प्रेशराइज ना किया जाए, मतलब बस ये।
आप कौन से ईयर में हैं?
मैं अभी ग्रेजुएशन फर्स्ट ईयर।
आपका सबसे फेवरेट टॉपिक क्या है?
मेरा फेवरेट टॉपिक इंग्लिश, बस यही पसंद आता है।
आपके सबसे अच्छे नंबर भी इंग्लिश में आते हैं
हाँ
और उसमें प्लानिंग नहीं करनी पड़ती है।
हाँ, उसमें याद नहीं करना पड़ता क्योंकि स्टोरीज है ना, तो फिर हो जाता है।
और सबसे बेकार सब्जेक्ट
मैथ्स।
फॉर्मूलाज। सर आई वांट टू एंड दिस, ये बहुत लंबा हो जाएगा अगर पढ़ाते चले जाएंगे। मेरा ये कहने का मतलब था कि कोई भी काउंसलिंग सेशन स्टार्टिंग में वैसे शुरू होते जाके नहीं था, थोड़ा डेवलप करना पड़ता है। मैं बस ये कन्वे करना चाहती हूँ। आई एम आल्सो इन सेकंड ईयर सर।
Okay. I didn't understand what you said at the end.
सर
What did you say before that? You wanted to close and then you said something.
सर मैं इसको आगे एक्सटेंड नहीं करना चाहती। Oh, so I don't want to extend this session a bit because I only need to form a essential rapport. I just don't want to come on a conclusion. What is your difficulty?
Any feedback now? Yeah, stay back.
Yes, sir. Tiwari, Jaya Tiwari.
Huh?
Jaya Tiwari. Jaya.
Yeah, any feedbacks?
Causes of dislikeness and factors for likeness.
Pardon?
causes for dislikeness of particular subject and factors for likeness.
Okay, that's the important thing is to talk about the facilitating therapeutic relationship. We are talking about the therapeutic relationship. Yeah. So in that, what are the things which yeah.
Can a client and a therapist can sit face to face?
Online participation.
Like they can sit face to face. I want to ask a question.
They can or
They can sit to face. Like we are there.
Please don't think that whoever asks questions I will bring them here because it's very interesting. I just want these are all very important things in therapeutic relationship. I'm glad that we are able to work together. Yeah. So,
We are sitting
yeah.
face to face. Like
Yeah.
we can see our face and she can see her face and she can also see.
Yes.
We can sit like this because we have thought that therapist doesn't see the face of the client.
So that's the only psychology. Because the L-shaped love.
Like the
Psychology.
okay.
Thanks, Arjun.
Okay.
Okay. Now, you're talking about transaction analysis.
No, sir.
No, okay.
Psychoanalysis,
Fine.
if Freud used to sit at the back
Yeah.
and
No, I just wanted to suppose you sit in this chair. How do you feel comfortable or not comfortable? You are comfortable. Yeah. Suppose can you sit here? You don't move the chair. Yeah. Maybe it's. Yeah, this is how a psychoanalyst would sit in a kitchen.
I can't connect with the
So I think the question, you have answered your own question, and this is the better one. Yeah, now, you stay back there, yes, please stay back there. Yeah, okay, there are a lot of things to be asked. And one main, there are no mains. Someone at the back,
any male volunteers.
you don't have to talk, please come. And non-talking male client, yeah. Oh, that's yeah. Wait. Let us ask you to make comfortable and sit here. Here's a client who's come, yeah.
Hello, how are you? Are you comfortable with it? My name is Jaya. I am a counselor today. Hello, how are you today?
I'm good. How are you?
Are you comfortable with the touch?
Yeah, sure.
My name is Jaya Tiwari. I will be the counselor today. Please have a seat.
Myself, Aditya Welcome.
So, are you comfortable with the sitting arrangements?
Yeah, sure.
Okay. So, I will be counselor for today. So, from the path towards the entry of the room, is there anything that disturbs you or something that comes to your mind?
Nothing.
Okay, so you're comfortable. Fully comfortable.
Yeah.
So, when you come in, do you notice how the weather outside?
It was quite hot.
Mine. It's May.
Yeah, it's hot.
Blender हो गया है. So, I have this book and I believe.
Are you comfortable with this?
No, sir, I have never been in the setting with a male. Maybe this would be one thing that is maybe the process. I don't know what to say about it.
Do you think that Jaya is sitting in a comfortable way?
As earlier ma'am said, like crossing, I guess, like the first session.
I was sitting comfortably in the first session, but
Yeah. So that's what I said about the context. A lot of things do matter. You asked her about the physical distance, right?
Yes.
And he said comfortable.
Yes, that's why I have mentioned.
No, you asked about the physical touch.
Yes.
The distance? No, yes. So you should see the facial reaction. Yeah, see, you as a therapist need to be aware of how comfortable you are in dealing with the situation. He may want to sit more closer.
I have physical independence. I can move myself.
Yeah, but may not be in the clinics where you work. Yeah, may not be in the clinics where you work. It's not that close. Yeah. So what I meant is, do you feel that this is better? Talking.
Now it's better.
Yeah. Okay. Okay. It's also mute. So it might look all small things, but all these things do matter in establishing a therapeutic relationship. That is not my primary objective. I mean, not reaching anywhere I wanted to reach. I don't know. Yeah. So thank you very much. And you wanted to say some feedback. Is that done or? Pardon?
So earlier I wanted to say that Arpita, in a very direct way, she started to ask the client that what is the problem with the client.
Okay.
But Jaya was more descriptive of the problem.
Yeah. It again depends on the context. Yeah. You want to say something? You sit here. Sit here. Yeah. If those volunteers, I mean, have to use the. Yeah.
Hello, good afternoon, sir. So with the facilitative word, I understand we have to facilitate the relationship between the therapist and the client. So if the client is, suppose, 15-year-old only, and that person is hard to open up, and you are not able to get him to open up to talk about himself, so you can maybe call her mother in between. Okay, so to establish a rapport with the client, so then the mother will be able to facilitate the relationship between the client is not does not want to talk about his problems or his life. You can talk about what the client likes to do, his likes and his dislikes. To be like to engage with him in a friendly manner, and maybe engage in playful activities, just to build that rapport. As the teacher also said, that rapport building is the most essential thing. So we can facilitate using other things or other relatives of the client. Maybe the caregiver, the parent, or his or her friend. Maybe.
Sit somewhere here. I mean, what's it called again? Yeah. See, what you're trying to say, if I understand you properly, is that involve other people other than the client to facilitate the
Yes.
conversation.
Yes.
Yeah, it probably depends on the situation like what where Sakshi was saying that he was not communicating
Yes.
the kind which Sakshi described.
Yes.
But here there's no need for having another person, especially adolescents do not like that actually. Just imagine yourself being an adolescent and you, instead of me talking to you or having a dialogue with you, I'm asking your mother about you. This is something which has been happening. Whenever some relative comes, this, it starts from there, right? And you want that also to happen in a therapeutic situation. It may not work well. Rather, it may be having an opposite direction. The client may not come next time saying that instead of talking to me, he is talking to the mother or she is talking to the mother and collecting all the information. And some clients have already told, you've already talked to my parents, why do you want me to come and talk to you? You already have an opinion. So adolescents, this is a very complicated situation.
Then I don't understand what does the facilitative word means exactly here.
Okay. So facilitative meaning the qualities within the therapist which helps one to relate with another person. So some of those things, if I start talking, I can take for weeks. For example, empathy is one of those things. So if you want to learn what empathy is, I've done workshops for a week on empathy alone. So it sometimes needs, it comes through practice. Sometimes you have different kinds of non-verbal communication is there. apart from the verbal facilitative things. So non-verbally also, which, yeah, Jaya Tiwari was showing, making the person comfortable, asking them to come and sit. I think you also, as a therapist, was asking, respecting the guy. That's again very important. So some people would probably sit and expect. That's what happens in a doctor-patient relationship. Doctor would sit there and call a person called by name. But if you want to be facilitative, I go out of the therapy room and invite the child or the people to come in. And if the child is okay, you have to be very careful with the touch, which again, she asked, is it okay to touch? That's very important. And even if it is an elderly person, touching is not an advisable one, even if it agrees, because it can bring in a lot of memories in the person. If there has been some problem, if there has been an unhealthy touch the person had experienced, and this is the problem with which the person is coming. So even touching has to be very careful. Some children are very like friendly, they'll come and play with you. And some children used to call me handshake tata because nobody shakes with the children in the hospital. So I'm the only one who would give shake hands. So that he would she would come to the hospital and say that she wants to be the handshake tata. Yeah, so did I answer your question about facilitative?
Yes, sir.
Yeah, so it depends. A smile can make a difference. You coming out and inviting can make a difference. For children, probably holding them in a particular way might make them more comforting. With their permission, yes. Yeah. I hope you have clarified that. Right?
Sir?
Huh? Did I or not?
Yes.
Okay. Yeah. So, yeah, you can be here, because in case I need to comment. All psychotherapeutic methods are elaborations and variations of age-old procedures of psychological training. So, that's literature. So, if you look at the first quote that I mentioned, there is something which has been told long ago before all the scientific therapies have come. And we might be able to find certain models from that. Therapeutic change is predominantly a function of common factors and emotionally charged confiding relationship. So that's again the confidence with which you are in the therapy situation. Confidentiality is again the privacy of the setting is very important. Because somebody said about anxiety. You said about anxiety, yeah. Do you want to work on that? No. Yeah. So because the setting is not conducive for working on one's own anxiety. If somebody is comfortable, that's a different issue. So it depends on the healing setting, a rational or a conceptual scheme, and a therapeutic ritual in some ways. An inspiring and socially sanctioned therapist. People look for, these days they Google it or go to LinkedIn, look at the profile, and then they choose the therapist. And this is an opportunity for the catharsis. I don't know whether you are aware of catharsis. Yeah, what is catharsis? But use the mic. Online people are watching.
Solution of a problem.
So release of pent up negative energy, mostly negative energy. The release of pent up negative energy.
There we need to know what psychoanalysis. Psychoanalysis, Freud was the one who talked about it. Catharsis, the psychic energy within, and it gets blocked, one has to release it. Something like a pressure cooker valve, I would say. So you burst with it, and then you are able to let it go out. How many of you have used pressure cooker on your own? Oh, good. Yeah. Some people are smiling, and nice to see that you're all doing that. Yeah. That reminds me of a lot of things which I'm not going to that now. My own experience with the pressure cooker. So catharsis is something which you let out and then you feel comfortable about it. That's what when we talk about one single session therapies. You go to the therapist, you are in a setting where you are able to let this go, and that heals for some. I'm not saying that it's all. Um, I think I remember a boy who came with the complaint that his mustache is not dark as it used to be. So he tried different techniques and things like that. So after that, he didn't come. I think he was sort of healed by narrating his experience and we having exchange about his own misunderstanding of things, etc., etc. So, practice of new behaviors which you were talking about. You were talking about the new behaviors. When we talk about the definition of psychotherapy, you were saying, new behaviors, exploration of inner world of the client, that's also very important. Which, when you talk about the inner world, what are you referring to? Yeah. Somebody can give you a mic. There, can you please? Yeah. That's why I asked you to come and please.
So inner work might mean a lot of things. So for instance in CBT, the inner work is basically the client's inner belief about their own self, their own values, and mostly inner work like let's say in psychodynamic context.
What's your name?
Amna. Amna.
Amna.
Yes.
Okay. Amna, can you talk from your own self when you talk about inner work? Because textbooks and theories will give you different things.
Yeah.
I want your experience.
Both will be my own values. So, like for instance, I like helping others, right? Also, my own perspective about my own self and others. So, it is mostly built through childhood experiences. So, let's say if a person has positive childhood experiences, they think positively about their own selves, about the world around them. Whereas if they had negative, experiences with their caregivers or with the world, they develop a very pessimistic outlook towards life. So I think inner work basically suggests to a person's own personal values. You have your perspective about everyone, about yourself, self-confidence, self-esteem, self-efficacy.
You're bringing a lot of things which makes me more curious to know. I think I will call you again, Amna. Right now, we'll stay with the inner world of each one of you. Whatever you are aware of the inner world, stay with that. If there is an opportunity, we'll see how best we can describe that in a different way. Yeah, the concepts in Congress is integration and eclecticism. I think yesterday Dr. Krishnadat was talking about eclecticism. Do you remember? Do you remember Dr. Krishnadat? That's why I also attended the session, so I know that he has talked about eclecticism. He said that if you ask most of the therapists who are practicing in India, they would say that I'm an eclectic therapist. So we are mostly eclectic therapists. That's what he said. So, if you have to understand about integration and eclecticism, you need to know what is eclecticism and what is integration. At least the dictionary meaning of it. What do you think is eclecticism mean? Yeah.
Very broad ideas of concepts. Broad ideas of concepts that we get from various sources.
How many of you agree with her? Yeah, you agree with her or you have a different one? Pardon?
I agree with her.
Oh, you agree. Your classmates or relatives? No. Okay. Yeah, anyone else? How many of you would agree with that? So integration is a combination and coordination of separate and diverse elements or units into a more complete or harmonious whole. Okay, that's a harmony in putting these things together. So when we do that with the theories, different theories of CBT or theories of REBT or that of behavioral therapy, we are putting that into a harmonious way so that there is a no conflict between them, but there is an integration. Whereas in eclecticism, is a selection of doctrines or elements from various and diverse sources according to their presumed utility or validity, usually for the acceptable style, system of ideas or set of practices. This is a dictionary meaning, but when it comes to therapy, I will give you integration as a conceptual synthesis of diverse theoretical systems, which I already mentioned. Huh. And whereas in eclecticism, in psychotherapy, is a technical, relatively a theoretical combination of theoretical methods. So when we talk about sambar, Madam said that she likes the sambar. We relish the sambar, which means there is a blend of different ingredients of it. Whereas in what dishes it stands out? Can you tell a dish where it doesn't mix but it stands out? Huh? Can't think of. Maybe fried rice. Yeah, in fried rice, I think the rice and the chicken and all those pieces are separate, right? They're not blend together. Maybe in noodles, fried noodles, it may be all blend, but in fried rice, they all stay separate. That's something like that, like this. Whereas in integration, those things are all woven together. I think there are different types of there are different types of integration. So if they are, oh, yeah. So if you are, what is your area of interest? Or you seem to have read something about therapies, yeah. Pardon? Humanistic approach. So I might stay with my humanistic approach and then try to integrate, assimilate, take another thing from another therapy and use it. For example, if I am a gestalt therapist, I may use a lot of things from the client-centered approach also into this. So that's called as the assimilative integration. There's no conflict between the things that are happening. You will find all these things happening. So the difference between eclecticism and integration is technical, theoretical, divergent, convergent, choosing from many, combining many, applying what is, it's a collection, whereas it's creating something new or a blend. So you create something new in your therapies or in your approach, unifying the parts, applying the parts, a theoretical but empirical, more theoretical than empirical, sum of parts more than sum of parts, realistic, idealistic. So this is basically the difference between the eclecticism and integration. Is that clear to you now? Does it make sense to you? Yes, no?
Yes, sir.
Yes, okay, thank you for being with me. Yeah. I will probably skip these things. Yeah. The important is Marvin J. Goldfried. I should also mention him because when I started working with clients, after a period of time, I realized that I am doing something different. Okay. I am doing something different from what has been learned before. I've been exposed to behavior therapy, has been with clients and our approach. I've mentioned that I told you that it's an interest in empathy and all. And then I found that these are not working out. So I discussed with a couple of my friends that, see, this is what I'm doing. And I find that this is how I'm doing it, but I don't want to call it as integration. I'm talking about late.
We move this session to our central auditorium where normal takes place.
Okay, but will
It
we
will
have?
take 5 to 10 minutes hardly.
Okay. Let me see where I am.
We give a pause or announce the online and offline audience.
That you can do. Maybe you can do that. Let me see.
We are moving the session to our central auditorium. So the things are getting arranged there because there are some audio issue or technical issue. So we'll be moving in our central auditorium. Okay, session will continue there. The same session, Sam sir will be conducting his session in the Central Auditorium where the inaugural took place. Okay? Have you understood all? In
And he also said that the time has not come to form a unified theory. So I was actually looking at, as I told, I was discussing with different people as to find out whether there's any theory which can unify the inner word which Amna was talking about. Can I sort of have a theory which can do that? That was my thought. Okay. And then he also said, I was thinking, can the theories from other orientations provide the answer, including the Indian thought? Whether there is something which has been there which can help us to form that thing. Okay? So it's an experiential work which I would like to do. I have two options. One thing is, so that when we go there, we can do accordingly. One of the options is that I give you a task and a small group assemble for a work, and others can see how the work is going on. And then I explain as to what has been done there. The other option is a different thing, which would probably involve it as an activity like we did before, because I'm also aware of that time. So, which one would you like to opt? Participants deemed desirable. So I apply my therapeutic goals here also. Yeah. What is?
Sorry to interrupt you. We will be shifting to central auditorium because there is voice problem for all activities. So students silently shift to central auditorium.
Yeah. No. So what would you like to do, please? Tell me. Pardon? First one. So some of you can see, relax, otherwise, is it? Okay, so the thing is, before we make things arrange there, I want you to go without talking to each other. And probably, can they walk around this place for 5 minutes? Okay, so you walk outside for 5 minutes without talking. Without talking. You can smile, but yeah. And when you walk, just observe your breathing. Okay. So when you breathe out, you say that I am. When you breathe in, what would you like to say? Tell. There's no right or wrong answers here. Pardon? Fabulous. I'm here. Okay.
Stop.
I'm here. When you breathe in, you would tell yourself that I'm here. And when you breathe out, I am fabulous or comfortable. Yeah, I'm leaving it to you. I would prefer if you can say I'm here. And when you breathe out, I'm comfortable. Okay, is it clear to all of you?
Yes.
Yeah. And there may be some chairs in the there will be some chairs in the front.